Dr. Santhan GOPAL,
Yeah.
a novel Amblyopia therapy, please.
Okay. If you have an instrument that's easy to buy, easier to set up, and is guaranteed to give results in 2 to 3 weeks of setup, and is not very expensive, would you like to buy it? You need to change your concept. And it is cheap because it is made in India or is being made in India. It's not expensive because it is not yet sold to a company for profit, and it is made by an ophthalmologist and sold to only ophthalmologists, but other people also can get use of benefit of this instrument. How many of you would think that this is true? Very few people will think this is true, correct? Because it is too good to be true. So I'm going to talk about setting up this instrument in a small clinic to a huge hospital to treat many of the ocular and non-ocular disorders at very moderate rate. And it costs you not much, but the returns within 2 weeks to 2 months, you can get all the money that you have paid for the instrument by treating patients. Okay? It's useful in treating amblyopia and related conditions in both adults and children. And you can see the effect of the use of this instrument within 2 hours of starting the treatment. How many of you have seen 2 hours of patching has given you effect so that you can actually see the results? None. You patch for years together. I have seen patients patching for 3 years. Whereas after 3 months, it is no use patching. But I have seen improvement with this instrument. Even after patching for 1 year, they have come and have treated and they have improved. It is too good to be true. And it costs only 1,47,000. It was a lot cheaper earlier, but because Putin invaded Ukraine, it added cost to us also while making the instrument. See, this is how the whole world is one world, one village, because the problem in one place can affect the other people. And you can see the effect in 2 sessions. You can definitely, patient also will notice the effect of using this instrument. And the full course of treatment is for about 2 weeks for up to 3 months. In 2 weeks compulsory consecutively, after that intermittently you can give the treatment. Easy to use even for children. The age group is 5 to 55 years, what I have used. Below the age of 5 years, it's slightly more difficult for children to understand certain principles of this treatment, but you can still use it. And you do not need a doctor to be there while the system is being used. You need to know the indications for its use and use them. And it's not heavy on your purse. Indications are many for use of this instrument. Amblyopia of all types, strabismic amblyopia, anisometropic amblyopia, congenital cataract post-surgery. In 4th and 6th nerve palsy in adults, you can use it to reduce the amount of squint and alter the head posture. In intermittent divergent squint, it will cure the squint. In DVD, it will make it latent from manifest. In recurrence of exotropia after surgery, it will correct the exotropia. It can be used in nystagmus where it will reduce the amount of nystagmus and makes the patient feel comfortable. And many of my users, which are about 109 as of today all over India, they have told me that they have used it in optic atrophy, though I did not give them the information earlier. They said it works. One of the person who used it in optic atrophy was Arvind. He is not there. He said it works very well in optic atrophy. Then it's used in congenital iridomacular dystrophy, where it improves the vision but not color vision. Post-squint surgery, where the movement is deficit, not due to muscle slippage, but due to some other reason, it improves the movement. So if you look at all these indications, general ophthalmologists can easily use this. And even if you charge about 750 to 1000 rupees per session of treatment, which takes about 45 minutes, you can make the money in about 1 month by treating one patient, or 10 patients if you treat for 15 days, you make the money which you have paid for the instrument. So financially it's very viable instrument, and I'll show you some videos as to how to set it up. This is simplest way of setting it up. There is a clamp which is fixed on the wall close to a power source about not more than 2 feet, and it's fixed at about 3 feet from the ground level, so that when you hang the thing, it comes down up to 2.5 feet. You can hang it at 4 feet also, there is no harm. This is the pre-COVID instrument, but I've changed this, I'll show you in a minute. You can see a child doing the exercise. There is nobody there to assist the child. We have explained to the child how to do the exercise, and she comes and takes the laser pointer from the receptionist and goes and switches on the machine and does it on her own. This is a child with less than 4 years who was taught to do the instrument with fingers instead of laser pointer, because I was concerned about laser pointer being given to the child. And finger itself, she points out the lights which comes on the board, and it works equally well. So this you don't need to understand. If you are keen, you want to understand how the machine works so fast, you need to look at this figure and understand this. It's a very complicated neurological figure, but no need to know this. Can play the video, please. Play the video. These are all brain pathways which you don't need to understand why, but if you want to know why the instrument works, you need to know. Okay, this is how the instrument looks like now. There are 2 programs in this machine. In this program, what is happening is the red light you can see is alternating with the green light. Can you see that? So the red light and green light alternate with each other. With a patient with a reduce the volume. Patient with a green laser pointer points out the light which comes on the board, and this he does about 800 times with the amblyopic eye and about 600 times with both the eyes. Now, why the ocular motility improves the vision? You may ask, why just by moving the hand and eye the vision improves? Well, you need to understand the previous figure, which is a complicated mechanism of improvement where the saccadic motion of the eye improves the ocular vision. That is the principle we make use of, in which what are called as top-down impulses coming from the frontal eye field area and parietal area go to the occipital cortex and fast forward the impulses to the temporal cortex due to release of nitric oxide. These are all sound very esoteric, but that's what happens in orthoptic usage. That's why some patients with orthoptic usage complain of headaches, because there is some amount of vasodilatation of the intracranial vessels. Initially it will be there, but it will pass off. Now the second program, in this you can see the red light is going around in circle and the green light is flashing. This is called as covert attention, where you fix on the red light and you can still fix on the green light and you can still count the red light. So count the red light 400 times to 500 times with amblyopic eye. This is called covert attention, where the attention from the parietal area is divided between the central and peripheral retina. Central retina because you are concentrating on green light, peripheral retina because you are at the same time the attention you are able to look at the red light and count the number of times. And if you do that, both these stimulate the occipital cortex and again improve the vision. The first one, where the laser light was used, it improves the hand-eye coordination, because the hand area is situated very close to the frontal eye field area in the brain. They are so close that stimulation of one leads to stimulation of the other. Stimulating the hand area leads to stimulation of the eye area, and stimulation of the eye area leads to stimulation of hand area. And from the frontal eye field area, impulses come down to the occipital cortex and stimulate the occipital cortex, and therefore they improve the vision. Play the second video of that lady doing that. Because most of the ophthalmologists do not go beyond the occipital cortex. You can see the lady is doing at the age of 40, she decided she will have an anisometropic amblyopia treated. And she went away because she wanted the instrument to be taken with her. She went off to US and she bought one instrument. After using it in my clinic for 10 days, she said, very good. I'm much better now. Let me take this instrument and go. I said, okay, feel free. Give me money. You can take my house also if you want. But that's 7 crores to 8 crores. She said, no, I don't want the house. I want the only this. And she took it and went. So you can buy 2 instruments and do the treatment in the clinic for 10 days, and after that rent the instrument out, but don't say as rent because the GST fellow will land on you. For anything he will jump on you and say GST. I was born just today, why were you not born yesterday, pay GST. So that's the way GST works. But anyway, Gabbar Singh tax will be added to the renting the machine. Don't tell it as rent. Sell it, give it to the patient as instrument for ocular treatment, which doesn't come under GST. And want to sell this, I have a clever trick. I say I have not sold more than 40 lakh worth of instrument. It works till now, but later on it may not work because once you register for GST, from instrument 1 I have to pay GST, which means you have to pay. I don't pay anything, you pay. So it will cost you more. If I sell it off to company, you will pay even much more because the company, I'm already in talks with the company who want, I asked him how much will you sell it for, not less than 4.5 lakhs. I said, okay, keep that 4.5 lakhs with you. I'm not going to give you a night now, but over a period of time I may sell it off. But this is a very good instrument to buy. It is better than your Binox because of the principle on which it works. The Binoc works on the bottom-up impulses. Any amount of bottom-up impulses you send, it gets stopped at occipital cortex level. Whereas our instrument brings the information down from the occipital cortex to the this thing. Brings down from frontal cortex to occipital cortex. So I suggest you to buy. I am the only manufacturer and seller, and I get it repaired also for you. Thank you very much.
So we should approach you to buy this machine.
Sorry?
We should approach you to buy this.
Yeah, on QR code, put that, I'll give you a QR code, you can copy that, photograph that on the PowerPoint. You can check a photograph. Sorry, they knocked on me and said I had to stop it. Okay. It's not coming there, it's coming here. There. You can take a photograph of that QR code and yes, there. Every detail will come. Where to buy it, where to